Hi.
I'm Natalie. I'm going to be your trainer today. So thank you for filling out this paperwork ahead of time. And we're just going to go over some of this, make sure everything's signed, and that we don't have any questions about what's going on today. We'll start with your informed consent. So with this, just kind of going through here, this first section talks about the purpose of the test. So we'll be doing everything today from resting vitals to testing flexibility and muscular strength and endurance. With that, of course, there are risks involved with any type of physical activity that you're doing. It can include, rolling your ankle on the treadmill, falling off the treadmill, anything up to including death. However, we do have all of the equipment we need to keep you safe. With that being said, the whole purpose of doing this is to, for the benefits of the test, which would be to get a baseline for you, find out what your current fitness level is, and use that to build off of to help with program design and whatever your goals are. With that, anything we do or cover in here, any questions that I ask or anything we go over, will be completely confidential, and then these files are of course locked up. So you don't have to worry about any of your information getting out there. Do you have any questions with regards to this form?
I do not know.
Okay, if that's the case, I'm just going to have you sign an initial. You'll write no questions here in this section, initial next to that, and then sign at the bottom.
So no questions.
Yep, and then if you'll sign down here, and then I'll sign after you. Okay, so going right into your health screening form, we'll just kind of review the answers you put down here, make sure that I have a full understanding of where you are currently. Just to make sure, you said you have been participating in activity
Yes.
at least 30 minutes a day, 3 days a week, okay?
That's correct.
Have you ever been told that you have cardiovascular disease,
I have not, no.
metabolic disease,
No.
kidney disease?
No.
Okay. And how about any signs or symptoms of any of those? So that would include dizziness or fainting?
Nope.
Ankle swelling?
No swelling.
Rapid heartbeat at rest?
I rest? No.
Chest pain or discomfort?
None.
Any pain in the legs?
Nope.
Heart murmur?
No.
Unusual fatigue?
No.
Or shortness of breath at rest?
I rest? No, I don't.
Okay. So you put here for your desired exercise intensity, moderate and or vigorous. Can you give me an idea of what exactly that includes?
Vigorous, more strength training, heavier weights, things like that.
Okay. So what do you consider to be, as far as intensity wise, what do you consider to be vigorous? So what?
Any type of like Olympic lifting or
Okay.
some powerlifting.
Powerlifting, okay. And then just going through your risk factors here on the back, have you had a heart attack or heart surgery?
No.
Cardiac catheterization?
Nope.
A pacemaker?
No pacemaker.
Heart valve disease?
Nope. Not that I know of.
I see here you have asthma?
I had asthma, yes.
You had asthma.
When I was younger.
Okay. And then, so you don't use an inhaler or anything currently?
I don't.
And you haven't had any issues with that, even during exercise as you've aged?
Nope. I haven't used inhaler in a while, so.
Okay. Do you have any burning or cramping in your lower legs when you walk or run?
No, I don't.
Musculoskeletal problems?
Nope.
Okay. Concerns about safety with anything that we're going to be doing?
No.
Okay, and then do you take any prescription medications we need to know about?
Not any right now.
Okay. And then just going through your other risk factors, you are a male less than 45?
That's correct.
Okay. Do you smoke?
I do not.
Have you quit smoking within the previous 6 months?
Was not smoking, so no.
Okay. You marked here, so your blood pressure is not greater than 140/90, but you also marked that you don't know what your blood pressure is.
Oh, no. It is not over 140/90, and
So then you have had it taken before?
I have, yes.
Okay. I'm just gonna have you, if you wouldn't mind, update your answer on that one and then initial next to that. So on the one where it says you don't know what your blood pressure is.
Use this one?
Right above that.
So I do
mark that you don't know what your cholesterol is, but then you also mark that it is above 200. You don't know what it is, okay. And your BMI is above 30?
That's correct.
Okay. Do you have pre-diabetes?
I don't.
Okay. Do you have a close relative, father before the age of 55, female before the age of 65, so think mother, father, grandparents, sister, brother, who had any heart-related issues?
None.
Okay. And you already marked that you're not physically inactive, so we're good there. All right, so moving from this, we're gonna go ahead and go right into your lifestyle questionnaire, kind of go over your current exercise habits.
Okay.
Okay, so for your lifestyle questionnaire, we'll just kind of go over what you marked here. I looked at this ahead of time, and there are a couple things that kind of stood out to me.
Yeah.
So you said that you did do sports and weightlifting
Yes.
when you're younger or currently?
Currently, yes. Weightlifting, yes. Sports, not as much. Sports was when I was in high school.
Okay, what did you do in high school?
Basketball and football.
Okay. And how long ago was that?
6 years?
Okay,
Yes, about 6 years.
getting up there in age?
Yes.
Yeah. And I see that you said your only personal barriers to exercise is time.
Yes, because
Okay.
of school and work, sometimes it's hard to find the time.
Yeah, what do you do for work?
I'm a trainer, and then I also, student, so.
Okay. So, for as far as your doctor training, where are you working at?
The Glendale YMCA, Peoria YMCA, and also the GCC Fitness Center.
Okay. And when you're at work, are you pretty active while you're there?
Yes, for the most part, standing and moving around.
Okay, so it's not real sedentary. Do you have an opportunity to work out while you're at work during the day at all?
I'd have to be either before or after a shift.
Or after, okay. But you do have access to the gym and everything?
Yes. I
Okay,
do.
good. So it says in the past that you've been successful, again, with sports, weightlifting. Do you
Mhm.
enjoy all those activities?
I do, yes.
Okay. Anything particularly you don't enjoy doing?
Cardio.
A cardio, of course. So I'm gonna assume if we take a look at your sheet here, it's gonna say you don't do any cardio?
Not much. Very lightly to warm up and.
Okay, just to warm
if
up.
that.
So no, nothing for like health related?
No.
Okay. We'll work on that. For as far as support goes, it looks like you have a pretty good support system. Your friends and family work out with you,
With me on their own,
both, okay.
yeah,
Yeah, good.
we exercise a lot, so.
And then stress for school and work, is there anything in particular that helps you to relieve that, or is there anything that I can help you with to,
For the most part, just working out.
okay,
It helps relieve
good,
stress.
that does help. And I see that here, workout. So moving right into what you have for your meals or your dietary. You're saying that you only eat 1,700 calories a day?
I actually don't know.
You
I
don't know how much,
I
okay.
don't know how much I.
You're kind of guessing?
Yeah.
okay.
Just random guess.
Random guess, all right. What we can do is we can work on that. We'll kind of go to the MyPlate website and figure out what your intake should be, and kind of get some suggestions from there on that can work with what your current exercise routine is.
Okay.
So I see your goal was also to lose 15 pounds.
Yes, that's correct.
Yeah, so those kind of work together, and we'll work on that. As far as your goals here, it says, it looks like the most important thing you're looking to gain by exercising is enjoyment.
Well, I do enjoy it. A lot of other things, improve strength, of course, and then increase some of the energy, just energy level because of working out. So.
Right. Do you have any specific strength-related or cardio-related goals?
Possibly one day get into powerlifting, some type of competition, possibly.
Okay. And then I see here 5 to 6 days a week, you're doing about an hour and a half, 90 minutes.
Yeah.
Is that a
For the most
consistent
part.
90 minutes, or is that like
Sometimes it's
like
broken.
25 minutes working out and then the rest of the time taking pictures?
No.
Chatting with your neighbors? No, okay. So actually 90 minutes of working out.
Yeah.
Okay, and then you said you don't do any cardiovascular or endurance.
None recently.
Okay. Do you have time to incorporate that into your exercise routine?
I probably could.
Yeah, because that's going to be one of the biggest helps for getting you to lose some of those 15 pounds you're looking to lose.
Okay.
It looks like you've been active for a while, and you mentioned you don't have any previous injuries or anything like that. So
No,
there shouldn't
no.
really be any restrictions for you to begin working out.
No.
Yeah. And then I see here what your, like you said, your current routine, 5 to 6 days a week with strength, just cardio to warm up, and then you're doing stretching only 3 days.
Yeah, so
Okay.
usually when I'm sore, I'll
So
stretch more
depending on the
often.
assessments and how things go, we'll work a little bit on maybe increasing the amount of time you're doing cardio and stretching. We should usually be stretching at least as many times as we're doing strength training. So we want to make sure we're keeping everything mobile. But other than that, are there any other specific goals or information that you want to tell me about before we get started?
No, that's about it.
Okay, perfect. So we'll go ahead and we'll start with your resting vitals, so your resting heart rate and your blood pressure up next.